That was a lot of information in a very short amount of time. I would like to welcome guests to the stage now. We have Lana and Prasoon, and hopefully Mo too. Yes, Mo, how are you guys?
Good. How are you?
It's so good to see all of you.
Likewise. Happy to be here.
Good.
Yeah, glad to be here.
Lana, you definitely win the competition for the background. So, Mo, you're muted.
Muted. So if I'm telling you there is actual robot that will come and start
I
drawing
love Mo's
something on the
facial
background
expressions.
for real, and then it remove it and then it starts to draw. So that's why it's a very plain. So it's just a bit noisy.
Okay, until we see the prototype, Lana
will
wins.
send
Lana
you.
wins the competition until we see it.
Thank you.
So we're here we're live from 4 different countries, right? I'm calling in from Cairo, Lana from Amman, Jordan, Prasoon from the Bay Area, California, and Mo from Barcelona, Spain. So we have a lot of opportunities for the listeners. Most of our listeners as Health 2.0 Egypt have been on the innovator side. So if you are out there, you have a company, now is your time to ask these people what investors are looking for, because all 3 are investors in different ways. Again, Lana is the managing director of Hikma Ventures, the biggest fund in the region. And then we have Prasoon, who just launched Wise, and he is earlier, like talked about precision medicine, so he has been leading AAPM, and now they are creating this major global vehicle with a Global Health Innovation Fund to invest in companies. And then, as I mentioned, Mo is running an accelerator, has started one of the biggest accelerators in pharma, has seen a lot of companies grow over the years. And so while the questions come in, I want to start off asking you guys, since this session is live and global, like how can local funds and global funds collaborate together? And we can pick any kind of person to start. But my question is, back to Lana's point, like sometimes we talk a lot about innovation in the region, but then how many startups are ready? So what is the value chain that we need to get through so that someone like Prasoon can invest in a place like Egypt ultimately? Lana, you're much closer, but I want to start with kind of the gap here. And Lana, I'd love for you to comment on this to get us started.
Yeah, sure. I think, Omar, if you look at the different spaces in now in the startup world, you see that fintech, for example, is now at a much more advanced stage than digital health, and you're already seeing, I think, Sequoia already invested in a company in Egypt. So, I mean, there are kind of funds that are coming to the region, and I think it's a matter of time until they do, and it's up to us. Like, I feel like, as Hikma, we're a global fund. So actually, we've invested in 12 companies, as I mentioned, and all of them are North America, none are in MENA, actually. But hopefully things will change in the next couple of months. But we've co-invested with so many, international investors, and during our interaction with these investors, now they're learning more and more about MENA. So for them, like, MENA is just this kind of black box. Or was this black box in the past, but now when we speak to them and we tell them, oh, guess what, we're looking at these 3 companies in MENA, like one is a telemedicine company, one is in the mental health space, etc. It's piquing their interest. That's how I can phrase it for now. Like, none have yet said, oh, we're ready to kind of put in money in the region, but they're like slowly but surely kind of becoming converts of like, MENA is interesting, and they're beginning to get kind of digital health.
Awesome.
Yeah.
So Prasoon, same question for you. What would it take for you to invest in the region?
Yeah, I think that's a very good question, and thank you, Lana, for sharing that perspective. Actually, I think, and that's why I think Omar, you mentioned about WISE, right? So that's one, motivation behind WISE is to bring the global ecosystem together. It's world in investors and entrepreneurs society, and we meet once a year actually. That's in a summit that will be in January, first week. It's January 8th to 13th in San Francisco Bay Area, and around that time, the world's all investors are in San Francisco Bay Area. So I think that's when we meet. But then we also meet quarterly, actually. So all the regional entrepreneurs and investors are while they are talking to their regional companies, if they find, hey, this is one of the technologies that needs a global stage, actually. So that's when they bring it to our quarterly meetings, actually. So the quarterly meetings, this is where we invite all our investors in our ecosystem, and they take a look at these startups. So this is just a closed meetings, only investors and the invited startups, actually. And then we also have built our own due diligence, actually. So, so we can even support the due diligence, and we are also raising our own fund, actually. We have had one fund, that fund one we invested. We are creating fund two, which is up to 100 million, actually. That will and it's a global fund, so I think that it'll be, and that's the goal, to invest in global promising companies. And we are also we have also AAPM, as American Association for Precision Medicine, is raising a foundation fund, and it will be given out as as a grant, actually. So I think we are starting with 10 million, actually. So the goal is to bridge to support clinical trials. So there is a bottleneck when a company has to do a clinical trial. They go to investor, and investor says, hey, I want to see the data before I invest in you, and the entrepreneur wants the money to run the clinical trial. So I think there is a very that's where the companies stall most of the time. So we are launching this fund where we will give out grants, actually, to the startups, and then kind of bridge that a gap, so that now they are very much ready for the fund and for the investors in our network to basically able to confidently invest with the data in front of them, clinical data, trial data in front of them. And that basically now we have filled that void, actually. So yeah, I think that's the whole ecosystem, Omar, and I invite you all to be part of it, and and lead the revolution together. Yeah.
Yes, and we're definitely looking forward to having people like you kind of join us in the region and start understanding, helping us kind of bridge that gap, because I think we're able to have this communication now, and there shouldn't be a reason why we can't. But what do you think about that, Mo? When it comes to someone like Prasoon is raising $100 million fund, he wants to invest in the region, and you've seen so many companies in both America and Europe kind of go through different stages. When you look at the Egyptian market now, do you think it's ready for Prasoon?
So Egyptian always ready. Yeah. So yeah. So it depends on definition of what is ready, because I think in the case of Prasoon, he's not looking for like a $1.3 billion valuation. He's expecting, when he's doing the investment, of early stage and seeding. And I think it's a great opportunity if such a fund started to appear in the market, because what they will do in this case, they will be one of the early players, and early players will be able to shape the market where they want. And I think this is what will differentiate, and whoever will start, and in this case, like Hikma and Person, if they come up with those funds and they started to shape the market as they want, they will be able to lead where the investment and what type of startups will appear in the market. I think what is missing is not like the market is not ready. What is missing is this database of the actual due diligence and acceleration programs that can be one layer before what is happening now, that kind of preparation of the startup to be able to sit with Lana or Prasoon and started to have a full conversation that makes sense from an investment point of view. I think the startups are ready. And I remember first time I met Omar, it was in an event in EUC, I remember, in Greek campus. And my message, it was at this time I was in Novartis. I was telling them, like, the whole point that you are just running and doing exactly same startup, but 15 version of it. What about like all of those areas that all the pharma and all the investors are interested in, like clinical trials, recruitment, and a lot of areas? How about that actually you go there and start to speak to them and start building this? So if you are telling me now, is the market is ready? I think the market is in a perfect shape that it needs someone to shape it. And this normally is the biggest return, because if you look at putting 100 million in Bay Area is already 100 million is nothing. And exactly. And the market is already, and I saw when we were hiring for startups, like when we were getting our recruitment, the whole point, startups has like 15 options, so they choose. And most of the startups, they were with Novartis and at the same time with Google. So like the competition is different. So I believe there's an opportunity for Africa, there's an opportunity for Middle East and MENA region to start building what was Bay Area 15 years ago. So I think this is where those 100 million and 200 million is ready for the market.
Yeah, and then and our fund, we are thinking to make it evergreen, so it will never dry. So we just basically keep investing actually. So that's how we have done it. We already invested, now raising second institutional. So it'll be like the constant And one thing that we are also doing is we are also setting up local innovation centers. Actually, we have partnered with some of the great players in the field, and we are trying to set up innovation centers in Middle East, Africa. You mentioned, Canada, India, China, actually, Europe, and US. We already are in Silicon Valley. So I think this, what it will do is it will, like you mentioned, that it will identify the startups and also identify where their weaknesses are, and then fill that gap and try to, help them, prime for success. Actually, bring the right advisors and team members and stakeholders together to help them succeed. Actually, and that's when pharma like Sanofi, and other big players, they can come in, because now they can, now they are not investing, but now they are giving them projects and they are delivering, and then they are basically now getting paid for the projects actually, and that also serves for them proof of concept that a major player has already tried their product. So I think that's the amazing value proposition that whole ecosystem brings actually.
Okay, that's a very interesting discussion, and we've established that Egypt is ready as always, and that we can kind of shape what the innovation is next with someone like you, Rasoon. But we have a very interesting question from one of the founding members of Health 2.0 Egypt, actually. And it's kind of like the elephant in the room always. And Lana, I'm curious to know what you think about this. So the question is about infrastructure. So then this is Omar Zaki from TechCrunch in Austin, Texas, and one of the founding members of Health 2.0 Egypt. And he's saying, it's more of a comment, but be innovation-led entrepreneurs, not imitation-led. So speaking of like going and replicating Silicon Valley, obviously we have to deal with our challenges. And he outlines these challenges as infrastructure and regulation, right? That would facilitate doing things that we may not be able to do. And I think now we're starting to talk about regulation when it comes to telehealth, but we still don't have that in the region. So Lana, how does that impact you think how many companies you're able to invest in every year or every period?
Yeah, I mean, that's an interesting comment or question, but I mean, from our end, we obviously look at the most important thing, obviously depending on the business, but the number one thing that we look at in digital health is clinical validation. If we look at digital therapeutics, remote patient monitoring, etc., like that's the number one thing. We as a fund don't like to invest in kind of wellness apps that are not backed by clinical data. Where there are many of them, globally, not just in the region. But I mean, in terms of regulations, I think it's tricky. Like, at the end of the day, we can't just wait for authorities to catch up and decide to make certain rules and regulate certain areas. I think, and I mentioned it in my talk, like it's better to ask for forgiveness than permission. That's the way I think people should operate. Otherwise, like there will be no disruption, and eventually, the authorities, governments, etc., they will all catch up once they see the value. And we've seen that. Like, imagine if we didn't have telehealth companies prior to COVID. Imagine if there was no Atibbi, no Visitas, etc. Like, all of these companies helped a lot during COVID, and fortunately, the governments, unfortunately, they worked with them once the pandemic hit. But if they weren't there, imagine what would have happened. I think they facilitated, or they've enhanced convenience. They've made it easier for patients to see doctors from the comfort of their homes. I think it's a matter of time before drug delivery or e-prescriptions become a norm. I know in Egypt there are a handful of companies, in the UAE as well. Atibbi now is I think also planning to get into that route or into that space. But I think all of these technologies are going to become mainstream. It's just a matter of time, and we can't just wait for regulation to change or to be actually invented in these spaces. So we I'm all for these startups disrupting the space, and just doing what they do best until everyone else catches up.
Yeah, and the regional imitation. If there is a regional need, I think there is a room for innovation. Actually, that's because a lot of you see a lot of Chinese companies, right? They were not the first, but I think they are now catering really big market in China actually. Whereas the global players, it will take them long time to establish their foot in China actually. So I think there is a lot of room for regional innovation, and then we all learn from each other, right? Actually, I think that's how we evolved. So I think you don't want to wait to support your local community, hoping for some global player will come 20 years later from now, right? So you just get in and roll your sleeves and do your job right now. Actually,
It's a good point, and actually, global players don't come anymore like by themselves. They need to find the startups in the market, and then they will acquire them. So they don't do it themselves, because all the global player stopped already the fact that they start business themselves in new regions. They want to go to find the startup who already made it, and then they will acquire, which is a good opportunity for exit as well. And you saw this with Sue, with Uber, with all of them. So no one anymore want to build something from scratch. From a regulatory point of view, and I think we're lucky in Middle East, because if you look at, there are 3 patterns in Middle East, sorry, not in Middle East, but like globally for health. You have the US pattern, which is try everything, and you have European pattern, which is don't try anything, and you have the Middle East one, which is like whatever it takes. So those 3 patterns are very interesting, and Middle East is the one that exactly, and I love what Lena said. Actually, it's more about like ask for forgiveness, so they will allow you to do it if you are not touch specific areas, and healthcare will never touch it. So in my point of view, I believe most of the government are very open, and even if you look today in UE, after there become a couple of startups and companies about telemedicine, they are working with startups to shape the telemedicine regulation. So you can see that whoever will start early will be able as well to support the shaping of the regulation. And this is what happened with Kareem, for example, that they shaped this. So, and in many conversations in different areas, health and non-health, government were very open of conversation, despite we always have the impression that it doesn't. They normally don't care, but actually they care, and they are very open now, especially if you look at Egypt, for example. The government today has a straightforward regulation that they would need to support a startup to be the leading in Africa. So it's a direct, rules now. So however startups comes, real investment comes with nice ideas, not a copy of an delivery system for pharmaceuticals. I think all the government will be open to help them to succeed. And I see it as an opportunity.
Awesome. Yeah, I think we hit up on a lot of different things, and it's sometimes just very disheartening when you see a lot of the regulations move innovation very fast, and it's important to remember that we can actually be the change. It's just sometimes a lot harder here than in a place like the States.
Yeah, and also the opposite is also true, Omar. Actually, in states, sometimes regulations are too much, and it's not that much regulated in some of the other regions, right? Actually, that's where innovation also can be, brought forward, because there is a lot of data regulations around, in US, HIPAA compliance. Like we have really, some things it will take for us something that we take. Take a take over. I think it'll take us some time, but I think at your end, if the regulations are very, very fluid around that, then I think there is an opportunity also to partner. Actually, I think so. That way we can partner together and get the clinical data, clinical trial data. I think and work around that actually. So both sides are true, Omar. Yeah.
Yeah, that's good for me to remember. Sometimes you stay in Egypt for too long, you get a little cynical. But
opportunities actually. Yeah, opportunities
also,
always focus. Yeah.
Yeah. So before we end this section, I just wanted to ask you one last question. It's I want you to choose a number. So let's imagine that we are talking 2 years from now, and you are looking at your portfolio companies, because you all have portfolios now. And I want you to tell me, like, how many companies would you imagine or would you like to have from Africa and the Middle East in your portfolio?
I think if we're talking about 2023, like in 2 years' time, we currently have 7 active portfolio companies. I would say, out of 15 to 20 companies, I would like to have at least 4 in MENA. So almost a quarter of the portfolio.
Yeah, and we are, as I mentioned, we have this Africa initiative where we are we are partnering with accelerators in Africa and actually investing early stage in not only in innovation but also trying to accelerate the existing companies. So I think I would say maybe a good number will be 10 to 15 actually early stage investments. Yeah.
And Mo.
No, we don't, like, our focus in current accelerator is Europe. And to be honest, I think as it was shared in my conversation with Lena, that it's what's a pity that most of the focus today in the Middle East is focusing on a very commercial based. So today we are not looking at this as part till we start seeing this change. So we are really looking at those type of accelerators that can push the market to create things which has a straightforward impact on our model. And I think this is where we will be able to see startups moving and compete. So, and again, one thing for all who listen to us, your market is the whole world, especially when it comes to digital health. It's not Egypt, is not Middle East alone, because one right technology for patient recruitment for clinical trial will be used everywhere in the world. It will not be used in one single place.
Awesome. Thank you so much, guys. This brings us to the end of the second section. So a lot to digest, a lot to think about. I really appreciate your presence with us and the time you've put into the symposium. Thank you.
Thank you.
Thank you,
Thank you very much.